So is there an expectation from your patient that you need to go there as an industry, like being more data driven, more like a customer grade digital experience in healthcare? Is there that expectation yet or not really yet?
What a great question. I think, what's interesting, and I think I'll use myself as an example. And this includes the continuum of healthcare. Not only, so we're providers, like we're considered providers in healthcare. So you have the provider group, and then you have the payer group, so the insurance companies. Patients, so a few things from what I've seen, my view, my lens. Patients want to know that they're being cared for. They want to feel they're being listened to. They want to feel engaged, and they want to know that whoever is working with them is providing the best care possible. And from that, and then the other thing I would say is making it easy for them.
Hi, and welcome to Digital Club. I'm Guillaume Cheno, CEO and founder at Ingeno. This show is built for the running real world operations. And today, that means the people responsible for delivering community while keeping the complex organization running. I'm joined by Bob Berbeco, Chief Information Officer at Mahaska Health. Bob, welcome to the show.
Thank you.
Um, Bob, let's say as an icebreaker, very simple question. How did you end up as a CEO in a rural healthcare organization? What path took you there? And yeah, was it kind of a normal path or life just brought you?
It was back almost 30 years. So a somewhat long and circuitous path. I'll make it easy for your audience because I could probably talk the entire 30 minutes about path, but I'll summarize it. Is I started off in something very different. Although my background, way back when I was a teenager, I was into programming, and it was
Nice.
very different when it was during that time frame. Programming was extremely different, and I always had this passion for it.
Mm,
Fast forward, I I actually have a bachelor design, so I enjoyed being creative in art, and I enjoyed being creative with technology. I pursued an art path, and I don't know how you can. There was a moment of reflection where I realized that I could be creative and kind of go back to my roots with technology. I can be creative with technology. And so fast forward, long story short, my whole IT path, and I started in healthcare actually. My whole health IT has always been shaped by curiosity, reinvention, always beginner's mind concept, always learning from others. And I've had this passion, this desire to build things that actually help people, making technology work for people. So I've been drawn to systems. I've been usability, clarity, that human impact rather than technology for technology's sake. And where I'm at in Mahaska Health is I have that ability. I have that ability to help our clinicians, physicians, the people that work here is, make technology so that it works with them and doesn't add burden to them. And so my passion here where I'm at today is technology will fit the workflow. I will work to increase trust with individuals as far as the technologies that we have and look to reduce the burdens that we have. And in rural health especially, I've been at large systems, I've been at small systems, I've been within the city type systems and regional systems. Within a rural, it's even more. The difference is that the mindset matters because every investment you make in what you're doing, it has to be practical, supportable, and tied to something real within our patient care operation. We don't have a lot of free floating income. It's just we can wait, but we have to be very, very precise and crisp on when we spend money on technology. It has to fit needs of the people who are using it.
So, yeah, talk to us about Mahaska Health. So, what do you do
Yeah,
exactly? Where are the facilities? What's the operation, and you're exactly in the organization?
absolutely, absolutely. So, what a week looks like for me is I sit at the intersection of patient care, operation efficiency, and innovation. I oversee IT, so that's the keep the lights on type services, data science, AI, cybersecurity, informatics, and my world, that scope spans everything from uptime and incident response and readiness, all that keep the lights on fun, to analytics, governance, provider, clinician, physician experience, digital access, long-term strategy. So for me, my week is a mix of strategic and optional. I have strict plans in place and drafted. We have digital events. I used focus, and in line with that, you have all the keep the lights on, making sure we're focused on system reliability, planning for system repents, epic related planning. It's a lot. I'll summarize it. It's a lot. It's a lot, and those who are within healthcare, I'm sure, can commiserate with me as far as what I'm saying. There's a lot going on within health, and as a CIO within healthcare, you have so many things. Things have changed. I can provide perspective in healthcare technology for a while. Historically, it was servers and desktops, and maybe some telecommunications. It's gone from that to we have beds that require interfaces. We have systems that are like those Star Trek communicators. We have all of these things and AI being embedded within Epic that we're looking to use. IT has just become this huge world now, and
Yeah,
everything connects to it.
it becomes, I guess, I'm kind of an assistant. It's kind of
Yes,
omnipresent, right?
yes, yeah, absolutely.
So tell us about the scale of Mahaska Health. How big are you guys, and where are the facilities?
Yeah, absolutely. We are a critical access hospital here in Oskaloosa, Iowa. And what critical access means is we have 25 beds. So we are limited to 25 inpatient beds. However, our outpatient ambulatory, our clinic services are what we've been expanding on. So we have several service lines like oncology, women's health, other service lines are providing support and clinical services for those around us. And our focus is on our community. So we are kind of like a small regional health center here in Oskaloosa that supports the community of the surround and on their and we also have like ambulance services also.
Nice.
Mhm.
Um, Tell me, what's the part to your operations you're the most proud of, and works really well?
I would say I've seen this in healthcare. So I'm going to go take a step back for a second to answer this question. I've seen this disconnect is technology has historically been thought of as this. No one does it intentionally, but technology is something that gets deployed to people versus being involving people from the start. And where I'm going with that is what I'm especially proud of that has happened here is I myself, I've channeled being a good partner with others. And I sincerely look to build partnerships in our physicians and engage them. So that's the other thing too with physicians and clinicians is is you're pushing things to them and it creates their work for them. And what I've done is not only do I want to listen to what you have to say, I want to have you part of the decision making. So something that we've done here, and we're smaller, like in a larger system, it scales out differently. We're smaller, so that gives us a little advantage here. But I've created this center, and we also call it a brainstorming group. And it's a cross functional group of physicians, of clinicians, of purely technical people, informatics people, and data science, along with myself. And what we do is what what do we want to solve? What problems do we want to solve here? Or not solve problems. What do we want to optimize here at our organization where technology can help? We brainstorm it amongst ourselves, get feedback. We have different subgroups, medical directors groups, other groups that we work with to get feedback too. And that helps drive what we're looking to get accomplished. To your question succinctly, the thing out of is building that partnership, that bridge between pure technology piece with the customer piece. And in our case, the customers are physicians and clinicians and team.
Yeah, so human driven by real
Yeah,
needs. Yeah,
yeah,
yeah, yeah. That makes sense.
absolutely, absolutely.
Uh, Um, and what say is the hardest part of your job right now that someone outside healthcare probably wouldn't appreciate?
Yeah, yeah. I would say outside of healthcare, what could get missed is technology. And I think I might have touched on this earlier, is technology isn't just about the software, the infrastructure, speed to market, those types of things. For us, the stakes are human. So if it's just an inconvenience, it could literally be there's someone in a surgical suite having surgery done that it impacts something that is being done with the surgery. So it has real world, maybe life or death consequences. So you have to take that extremely seriously. And even small workflow changes. So anything that we do that does something to a workflow, we have to be very mindful that it has this downstream impact, a ripple effect across patient care, staffing, could have potential consequences. So sometimes I think outside of healthcare, uh, there's real world consequences there. Ours are human, like they could impact human lives. The other thing too about healthcare, and I think I touched on this earlier, is we, it's everywhere. we have we have everything. And the other thing too is we got to balance that need of making sure that we're meeting the need of people who are customers, which are clinicians. They don't like how I look at technology is technology should be like a light who from a user perspective or a clinician perspective, a physician perspective, they want it to work. They want it when they need it. They want it to be able to make it simpler. And kind of like it would be for us when you have a water faucet or a light. I don't need to know how complex it is. I don't need to know how cool it is. It could be really, really neat underlying all of that. I just want it to work. And so that's been my focus is the technology will focus tech people focus on technology, make it cool and really neat as far as how it looks. But from a customer perspective, I want to make it simple and make sure it just works for them.
Yeah, accomplish something complex, but in a simple for all the users, right? All
Hmm.
the patients and the employees. Yeah, I like that. Um, yeah, so maybe building on that. Let's talk about data and interoperability. I'm gonna say it
It's
across
a
the
hard one.
yeah, it's a hard one. Across the organization. So sometimes in healthcare, what I hear is I have different systems and they don't really talk to each other. So there's out how you guys with that. Is it something that's going really smoothly? Is there any struggle that you feel you need to improve? Tell me about that.
Yeah, I would say going through the path I've taken in life, the good news is I've seen it improve considerably beyond just having interfaces of an interfaces. Now the technology has caught up to having a system through an API call or something like that. it's simple work, still takes
Mhm.
someone building it. But the technology, now I'm going to say simple, but the technology piece isn't the focus. I think what I've seen with interoperability, the issues that we have is that data, like the data governance. So as data is passing from one system to another, not only do you have to make sure that the data veracity in each one of those systems is in a good place, you have moving down the path, it's going like the data lineage to go. And I was biggest, and that's actually, candidly, that's something we're working on here is systems that have data in them, whether our EHR, our other subsystems, make sure that the data from system to system has a clear lineage path and make sure that it is truthful. Something I think that's always going to be ongoing, super hard. We're working on that here. Is first actually just starts with identifying. Data's everywhere. So start with the identification process first.
I guess there's different level of altitude about data, right? So
Mhm.
there's about the organization, right? Analytics is the organization health right now, and there's also down to each patient. So, for example, if you have a complex patient, quote unquote, can you give us like the complete picture of how you can achieve providing the right information to the right people at the right moment about, yes, it has, let's say, a complex situation?
Wow. Yeah. That's a
That's a hard
really
one.
you're gonna start with the softball question. No, I'm joking. I'm joking. No, I think you're right on. I mean, and actually, there's I not to skirt that the answer to that. There's no real easy answer to that. I would
Mhm,
say where you got to start is you have to have. So where I would start is if we have a process, and it sounds like you've just suggested one too. So we have a process from here to here. Got to map it. So start with what you know. And I'm very process oriented. Just for folks' awareness, I have a Six Sigma black belt, so I'm very process
mhm.
oriented and very much into optimizing those processes. So whatever this process is, this particular one, we're going to map it. We're going to have a clear understanding. Okay, here's what we have today. Here's our current state. Here's the touch points in that current state. Here's the data. If we want data to flow at the right time, at the right moment, and being viewed by the right person from here to here, map out how that's going to work. And another key piece of that, as you're doing that, the dangerous thing is to assume. So, me as a CIO, assuming I have this big brain, I know everything, I could go down this dangerous path of saying, well, I think this is the way it is. Doot, 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 doot. No, go with where the source is. So at those source points, identify what what it is, where it's going to go, what are some dangers associated. Map that through the process, identify it. Then, only then, when you have a good understanding what that process is and how that's going to look and where it's going to go and who's going to use it, then you could start decomposing that into a plan around how you're going to get it there. I think the dangerous thing is, that's the dangerous thing about systems. They can make things really easy. And in this sense, if you're not doing it in the right way, they could do it in a dangerous way.
Interesting. So, would you apply this to, let's say, patient workflows as much as your organization as a whole?
Yes, yes. So something this is great. I love it. We could dig deeper into this. So part of my role is I think I touched on it. I have a group of people that are called informaticists, and they do a functional piece of IT called informatics. Much of their role, they do training and they do other things, but much of their role and their focus area is how clinicians, physicians, people who are interacting with the EMR, how are they interacting with it? And if there are touch points and different data points and different workflows, how does that look? And much of their role is not only identifying that, mapping that, and documenting that, but looking to optimize it. Like we have a number of processes. Um, I could probably go down another path of talking for a long time, but here's a good example. Is we came up with we have a new service line that came up recently, and it's oncology. And with these service lines, there's a lot of complicated. Bringing a new service line into your hospital is a complicated thing. That's something else that can get missed within healthcare. All sorts of people interacted with it. There's financial aspects. There's a whole bunch of things that need to get built. When you do this, oh, and you're bringing physicians in. When you do this, you have a plan. You map out all these different sequences, all these different data points as much as you can. There's some things that you may not be able to get too granular, but at the very least, you need to know those processes, how they flow, and how people are going to interact with those processes, so that you know what the starting point is as far as, are we meeting best practice? How do we meet best practice? How do we make it better?
Interesting. Um,
Yeah.
let's say to build on that,
Hmm.
on data. So these days, there's so much data that you can now collect about
Hmm.
patients, right?
Hmm.
Just
Hmm.
with my Apple Watch, for example, there's few metrics that could be gathered and used to analyze my health, but there's tons of other devices and sensors. How do you see this is making healthcare evolving? How do you see using those data points to better serve your patients?
Yeah. Wow. That's a great question. I think what helps. So part of healthcare. So right now, healthcare tends to, and I think I may be stating the obvious, healthcare tends to be fairly reactive in
Hmm.
today's state. We're treating people after they're sick. Where this could head is, there's a lot of, so right now there's manual things that we do to remind people on what they should do, colonoscopies, different things that they need to do, self checkups. And I'm thinking I'm totally going down this realm of where technology can become embedded so much into people's lives that they would know, like they would have an EKG that can tell them something, a data point. Within rural health, one of the big issues that we have is, we're this hospital in a rural area, and many people are driving like an hour and a half to come to us.
Hmm.
And these technologies that you're mentioning can give us an opportunity to have that outreach, and maybe be able to monitor, like remote patient monitoring would be a way of doing this, is be able to do that outreach and remotely monitor some of their metrics, so that this interaction can then become virtual, and they don't necessarily have to come to our hospital. That would be one of the goals. You could, of course, embed AI into that. I'll just use Epic as an example. Epic is going down this path where they're going to have tools for patients that are going to be embedded within their patient, not their patient charts, but like the remote patient chart app. Clinicians, you have my mind kind of blown, because I'm thinking of all the different possibilities, and I'm trying to answer your questions succinctly, because I think it just opens up this world of possibilities for us, and we, as healthcare professionals, we have to be mindful of how we can make those work for our patients. That's really it.
I'm not super familiar with Epic, so it's a
Hmm.
software,
Sure.
right?
Uh-huh. Yep.
About that for healthcare facilities, or tell me about it.
Yeah. So Epic is healthcare organizations. We have these EHRs or EMRs, and Epic is one of the big ones. You have
Mm,
Epic, you have Oracle Health, which used to be called Cerner. You have Meditech. There's a few of them, and in our case, Epic is what we use. Epic is one of the larger EMRs. They've been building market share, and they have this. So you have two approaches when it comes to healthcare with AI. and just different solutions. One, you can follow the EHR like Epic's roadmap. So Epic has this roadmap. They have this roadmap. As a customer, you can see it. They're telling you, hey, this is where we're headed. This is what we got available now. This is where we're looking to go in a few years. Gives you an idea where they're headed. This um, having AI in a lot of these different systems that are kind of third party right now, embedded into your EMR, become powerful. There's no longer a need for a third party integration. It could be within your EMR. Now that's if like Epic or the EMR company pulls it off in the right way. That's the only point you have to be concerned about is if they make it usable and they make it useful and it's really, really, really good, then that's likely something that is going to be something that a healthcare organization is going to follow. Either that, or you can bring in third parties. That would be you'd have to integrate them. That would be the only maybe a extra potential work. But if they have value, you would do that.
So, is there an expectation from your patient that you need to go there as an industry, like being more data driven, more like a customer grade digital experience in healthcare? Is there that expectation yet, or not really yet?
What a great question. I think what's interesting, and I think I'll use myself as an example. And this includes the continuum of healthcare. Not only so we're providers, like we're considered providers in healthcare. So you have the provider group, and then you have the payer group, so the insurance companies. I think patients. So a few things from what I've seen, my my view, my lens. Patients want to know that they're being cared for. They want to feel they're being listened to. They want to feel engaged, and they want to know that whoever is working with them is providing the best care possible. And from that, and then the other thing I would say is making it easy for them. And that's meeting the patient. So full disclosure, because I've been on a patient advisory committees, so there's a lot of buzz around what patients want. It depends. Some patients are okay with not having access to their chart directly. Many want it. Some people are okay with um think of some are good examples. Some are okay with like they actually want to come to the hospital and then others don't. So I think like the component of that for us within healthcare and kind of the challenges is, you know, so we have our patients out there and that's the question they're asking, what are they looking for? And it depends. And so we really have to be mindful and ask them and assess that. And where technology can come in is make it simpler for them no matter what it is. And that goes with the payer side too. People want to have their claims paid,
Yeah.
things like that. I mean, I'm thinking as the patient, I come in, I'll just use myself as a use case. I come in and when I have a provider that they have the knowledge that they need, there we go. Okay, that's where technology comes in. They have the knowledge that they need at their fingertips, and the technology isn't creating a lot of burden for them so that they could be engaged with me. That's it. There we go.
Yeah. So they might not ask for it, but
Hmm.
they probably truly when it's in front of them, they will
Hmm.
say, "Thank you for giving that to me." Probably
Yeah,
from what you're saying.
yeah, yeah, yeah. No,
I love it.
absolutely.
All right. Let's talk about workforce. So I am in Canada. So tell me if that relates to you. So here, let's say nurses, they work a lot, lots of
Hmm.
overtime.
Hmm.
There's turnover. So is the situation similar in the US? And how do you see technology could help in this with this situation?
Yeah. So it depends. I'm going to give you a depends answer. Within the United States, there are, so definitely I've worked at those that have had the issues that you're suggesting with burnout for sure, and to a certain degree we have that here at our hospital too. I think where technology can help once again right now, I think I'm just going to come out and say it. Technology, we think as technologists, we think that we're helping people with the technologies we're giving them, but in many ways, it's adding work to them. We have
Mm,
physicians who are having to work at night because they're having to put all these notes in the EMR. We have nurses who have to enter all this different data into the EMR. Like there's extra steps. So I think where technology can help is whether it's AI, we have ambient technologies that can be used. We also have there's things that are coming out that will be able to summarize. So
mhm.
within the EMR, a clinician or a physician, they have to kind of hunt and peck to figure out where things are at. And we're evolving to a state where those things will come forward as opposed to having to find them. So to answer your question, it comes down to burden. Where technology can help is let's make things easier for the people who are using it, the nurses and the clinicians, and reduce the amount of work they have to do.
So what you're saying is
And
that
mhm,
maybe sometimes technology adds friction today,
it does.
but it
Yeah,
should be kind of the opposite, right? It
it should.
should
Mhm.
make them be more efficient, more and be like super smooth and seamless to
Yes.
some extent.
Yes.
Hmm,
Yep.
interesting. Um, so if all this being said, looking forward, if you could fix one thing about how your organization or maybe even your industry in general works or runs right now, something that's been maybe on your list for a long time but keeps getting pushed, what would it be?
I would say, in generalizing, um, like within healthcare IT, I'd say, and we've kind of touched on that. There's this promise of digital transformation, um, and then you have all these different systems that are behind it. I think one of the things that we could fix is within our strategies, whether it's AI or digital capabilities, work on that fragmented data piece. I talked about data governance earlier. Data is fragmented. We have architectures that, for whatever reasons, are legacy. They're older. We need to replace those. And something doesn't sound like a technology thing, but it really factors into technology because technology won't solve it, but it's a part of it. I mentioned workflows and I mentioned like process maps. There is inconsistency as far as how workflows are managed within healthcare, and you would see that. If you and the audience members out there, if you were to just observe, and you would go from one clinic to another, depends on the organization, but you would see inconsistencies, and they're not dangerous ones. It's just they could be inefficient. They could add time. Different workflows, how something's managed from one area to another are different. And that would be something as a leader, that's actually what I'm working on fixing right now, but that would be something that I think that would help.
Amazing. Um, maybe building on that,
Mhm,
in let's say the healthcare industry, um, what do you think is the biggest opportunity for either software vendors or technology
mhm.
providers, so that we could somehow revolutionize how we do healthcare in general? So what do you think
Yeah.
is, aside from just, well, AI is going to help, right? So
Mm.
do you see specific aspects where, yeah, technology and AI can really make a difference?
I would say that, and are you thinking from the perspective of a a company or a solution or just in general? I
Maybe
just wanna make sure I'm getting the context.
something that would have a huge impact for you if you had those tools. So would you be able, for example, to 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 uh, to have twice as much or 10 times as much patient with the same number of people, but still giving the same great care, human to human thing, but remove all the, let's say, the repetitive tasks and the bureaucratic aspects of it. And yeah, so what could have a big
I
impact
would,
for you if you
yeah.
could dream
Okay.
about
Yeah.
what AI could do for you?
You can do everything. No,
Yeah.
I would say so. One of the things that I see today is, and there's a lot of buzz out there. AI is going to take jobs and all that. I, I I don't subscribe to that. I think that AI can be used to augment. And so something that it can do within healthcare is, and these are problematic things, is there's a lot of manual tasks that are being done when it comes to coding, billing, denial management, payment, just getting payment. So when our patients are seen, there's a lot of back office manual work and a lot of hours that are dedicated to things that a system could do a really good job of managing. Sure.
So let's say I'm another healthcare leader.
Hmm.
I don't know where to start in improving my processes, my workflows. I don't know where to start with technology. What would be your honest advice to me?
Oh, I would say my honest advice to that question, I would say to those new leaders that are out there is look to pair yourself up with someone who has that knowledge. One of the things that served me throughout my career from beginning to now, and even still now, is I'm always channeling this beginner's mind concept of I may know a lot, but I don't know it all. And if there's
Mhm.
someone that I know that has a snapshot of something that is not part of my knowledge base, I seek it just naturally. And so I would suggest that the others is there's a lot of folks out there that, one, seek partnerships, reach out to others. Don't just try to be your own person. Learn from others, create partnerships, create relationships, and not to like gain things from those relationships, but rather just learn from others and share the knowledge that you have.
Like it. Um, okay, Bob. So before I let you go,
Yeah.
quick lightning round of questions.
Mhm.
So first
Sure.
thing that come to mind, no overthinking. Um, so, in your opinion, what's the most overrated thing in health technology right now?
AI.
AI. I was expecting that one, I guess. Um, the one system you're in your organization you couldn't run without,
That sorry, we could or
could not
could not run
run
without.
without. Yeah,
I would say our EMR.
from your experience, best operational or clinical team you've ever seen. What made them stand out?
They gelled. They were one unit. They were unified. They all had a
Mm,
different lens and different background and different functional roles, but they became one singular unit.
nice, like that. What do great healthcare operators do that average ones don't?
Listen,
Mm, I like that. Also, um, last one. Uh, more philosophical for you. If you were in healthcare, what would you be doing
if I was not,
in healthcare and technology? Yeah,
I would very likely be an architect.
nice. What kind of building would you like to design?
Great, great
Hospitals.
answer. It's fast that you say that is, yeah, I would like to design hospitals, kind of merge the two,
Bring your knowledge to that, to
correct.
architecture.
Yeah,
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 great, great. All right. Hey, Bob, it was, thank you so much. It was a
yeah.
genuinely great conversation. I really
Cool.
appreciate your honest and candid responses. Really loved it. So I'm this is exactly what this show is for. So, for our listeners, how can we find you and follow what you're doing and building?
Absolutely. I am on LinkedIn and I'm the only Bob Berbeco out there. So you're welcome to reach out to me there. Pretty easy to find. Look for my name. Be happy to connect. Be happy to have conversations. Be happy to learn from what you're doing.
Great. Thank you. And thanks everyone for listening to Digital Leaders Club. If you're a healthcare leader dealing with similar challenges that we spoke with Bob today, um, we'd love to have you on the show and continue this conversation. So find us at ingeno.ca. And until next time, thanks again, Bob.
Cool. No, sounds good.